එන්න බඩගියද නෑ ගංගා ෆොටෝ මොඩල් ඉස්සරහට එන්න ඕනේ කියලා හැමදාම කියනවා සාවිත්‍රි උසයිද නායමඩ අතර උසයි නිරෝ Yeah. Huh? Who's patient? Patient है जिगारा नहीं short case එකක්වත් මේ වෙනකන් කරලා ඇති කට්ටිය අතොස්සන් ඒ කියන්නේ මේ SR කෙනෙක් රෙජිස්ටර් කෙනෙක් කන්සල්ටන්ට් කෙනෙක් එක්ක මේ අපේ මෙතේ පටන් ගන්නවා itu nanti yang udah kayak gitu itu nanti downside case indot kira nih this patient complains of dilated veins in his right leg. Do the relevant exam. You want to take history? Yeah, exam. What's the color? How to pahala? What about any value? Maka to kintu dina ama. Kakku mana? Mana wagene kakku matti. උදේට වඩා හවස් වෙනකොට වැඩිද? වැඩි. මොකද කරලා රස්සා? මොකද කරේ? ෆැක්ටරි. කවුද කාටවත් තියනවද? තියනවා. එතකොට කලින් නහරවල ලේ කැටි ගහලා මොකුත් ප්‍රශ්න ඇති වෙලා තියෙනවද? ඒ වැඩි ප්‍රෙෂර් දුමාතිය මොකුත් තියෙනවද? ඒ සේවා. Do the examination. Where are they consenting? Mama sama sudah baik di sisi. Mau pada kaya kalau pariwisata kan, kau itu tulisan terakhir di mana? Kan mama dah sama sudah baik di sisi. Wah, running commentary wah කැමති නැහැ එහෙම නැත්නම් examine කළා පස්සේ කියනවා. වා කැමතිද? ඔබේ ජය අපේ පැතුමට. commercial දැන් මතක නැහැ මොකක්ද? තප්පත් දැන්. මට පෙනියන්නේ මේ පළවෙනි වතාවට varicose vein එකක් examine කරලා බබය. මම running commentary දෙන්නද? Okay, with the consent of the patient, do whatever you want, whatever you can put up. Barang. Cukup lagi ini. යටින් තුස්සන උඩින් පදුවන් කරන්නේ කැහපට ගහනවා මොකද but you where in the night සරෝ නෑ මොකක්ද දන්නේ टर्निक එකක් දෙන්නම බලලා ගාව නැද්ද එකක් මේ හරි වටිනවා නේද මේ වාට්ටු විසික් කරනවා අද ගන්න එපා. දවස් ගන්නවා විසික් කරන ගොඩාක් ගන්න එපා මේ වගේ මාව වටිනවා. අපලා සාප්පුම් දාගන්න ඈ.
Menarik sih karena
බලන්න වටිනවා බල්කනියෙන් හරියට. Definitely. Okay. I can't provide you multiple tourniquets, just single. Go with the single. That? What is your diagnosis? What is your diagnosis? Varicose veins of right lower. Without subclavicular incompetence. Is it? In a scale of 1 to 10, 10 is pass, excellent pass, 1 is bad fail. Where will you put yourself? Yeah? Where will you put yourself? 1 to 10, a scale of 1 to 10, where will you put yourself? 10 excellent pass, 1 bad fail. It's okay. Having insight is the best thing. Straight away. When you have the insight, straight away. If you don't have the insight, no. I can't help you. Tell me your rating for yourself. I'll give mine later. 1, 2, don't know. Who's your history partner? Chintagar. Can you rate him? Rate, not rape. Can you rate him? Scale of 1 to 10. It's okay. You are not doing anything bad. It's a constructive criticism. Above 5 or below 5? 4, 5. I will give 2 or 3. Okay. But hereafter you can't. Today you are learning today. But hereafter if somebody asks you to do this, you can't make blunders. Okay? Right. So varicose vein examination is a long shot. Takes time. So sometimes they give the opportunity to take history, sometimes they don't. But even the examination takes time. So examine in standing posture. Saram put the camera gahana hitagan. Okay, unne tum camera gahana. Can you put a torch? So exam make you have the adequate lighting. Saman there are. So you go down. All these bones are නැන්දිවල නැමෙනවා. නේ? නැමෙනවා. ඒක නැමෙන්න පුළුවන්. පල්ලෙහාට යන්න පුළුවන්. මෙතන තියෙන ස්කොටින් පෑන් එකද කොමන්ට් එක. ස්කොටින් පෑන් එක තියෙන තරම් සෙට් වුණා බොහොම සෙට් වුණා යන්න එපා. නැමෙන්නේ. එහෙමින්ලා දාන්න. You know, if you get a spotting ban, whether you like it or not, you have no spot. Okay? Good. Oh, may I have it? Where's your partner? ඔයාලගේ patient එක මේ කතා කරන්නේ. Video exam එක. Good. මම පුතා ඉදුවා ගලුවා. අතත් නෝ. Right. So you go down to the level of the patient and examine. Remember, in your examination, in your presentation, remember 5 features. WHICH, not WHTACH. Are there any witches in your batch? Sintak, are there any witches in your batch? No? Bye, name again. Are there any witches in your batch? Yeah, so it's WHICH. So witches are which side, whether it's right or left. Number 1, which. Number 2, which level, whether it's above knee or below knee or both. Right? Side, right or left or both. Which side, which level, which system, whether it's superficial, greater saphenous venous system or small saphenous system or both. Which system. තුන්වෙනි එක which complications. Last one, which incompetence. Right? Which side, which level, which system, which complication, which incompetence. To answer 5th which only, you have to touch the patient. All the other whiches, just by inspection you can answer. So if I give a running commentary for the, according to those whiches, so right, on examination and inspection, this patient has dilated, multiple dilated varicose veins on the right leg, and also I can see dilated veins over the left leg, but it is more prominent on the right than left. It is mainly along the greater saphenous venous system on the right leg. There are no significant dilatation of varicose veins over the small saphenous venous system on the right leg, and it is extending below knee as well as above knee, and I can see a large bulge over the medial aspect of the lower thigh, which is compatible with Hunter's blowout. It is also known as Hunter's blowout. Hunter's canal canal adducting here, so it's called Hunter's blowout. Right? So I'm concentrating on only on this leg, but I have commented that there are varicose veins on the other leg. So to inspect the small saphenous vein, you can either turn the patient around you or you can go around the patient. Don't do this, don't just peep. You turn the patient or you go around the patient. So I have answered how many witches now? 3. Before I go to the other one, I want to inspect the saphenous support. On examination and inspection over the upper thigh, groin region, there is no obvious bulge, size of saphenous. What did you feel? You felt a thrill, right? Yeah. So there is a thrill over the saphenopharynx region. Where is the saphenopharynx? About 2.5 centimeter below and lateral to the pubic tubercle. Right. So on further examination of the right leg, there are no significant complications associated with varicose veins. There is no significant edema or no pigmentation around the gate area. There is no evidence of lipodominant sclerosis. There are no evidence of active or healed ulcers. Active or healed ulcers. So I am basically commenting about the possible complications. There is no evidence of recent venous bleeding. Okay. Then other. How many witches I have answered? 4. The last one. Last witch. So that is the witch incompetence. To answer that, I have to do the tourniquet test. මෙතන උකුල හඳේ මුත් කැක්කමක් තියෙනවද? නෑ. කකුල උස්සන්න පුළුවන් නේ, රෙදෙන්නේ නෑනේ. මම කකුල උස්සනවා. These are very important things. You have to ask before you raise the leg if there's any hip pain. If you get an elderly patient with hip pain also, if patient screams, you're done. Come next time. Okay? So ask that and then do it. Then I'm stroking this and emptying it. These veins are readily emptyable. These are emptyable veins. If they are not emptyable, what could it be?
Separates.
It could be arteriovenous fistula. They are not emptyable like this. But then you will feel something else also. Then thrill. So, but you have to say they are emptyable. These veins are emptyable. But this is difficult to empty because there is a huge bulge, but it has gone down. So you have to stroke it like this to facilitate the emptying. Don't do this, sir. That is massaging or stimulating. If you can't hold it, that put the tourniquet, somebody should hold it. Either you can like this or put the tourniquet, or you can tell the examiner, sir, can you help me to hold the leg up? So you can do this at the exam, but for girls I recommend them to get the help and then apply the tourniquet as high as possible. Then bahimu ending now. Coach, please. දැන් අර ඔයාගේ අර බල්දි කරවගේ ආවද? නෑ. I can see certain veins are appearing, suggestive of perforate incompetence. But on close observation, I will release the tourniquet. What happens? Filled up. So it's suggestive of saphenofemoral incompetence. But the fact that I felt a thrill on cough, there is a reflux there. But that's how you said here. You apply the tourniquet and get the patient down and observe. You might see some feeling that is due to perforate incompetence. Then you can tell on close observation you release the tourniquet. You can see there's additional feeling. The veins become more and more prominent upon releasing of the tourniquet. So that is suggestive of this. But if you can't detect that by naked eye, how do you work at the exam? Sir, I cannot clinically demonstrate saphenofemoral incompetence, but I would like to get a venous duplex scan for this patient because presence or absence of saphenofemoral incompetence will change my management plan, obviously. And anyway, I need a scan prior to surgical intervention to exclude deep vein thrombosis. Because if deep veins are not patent, can you do surgery to superficial veins? No, you can't. You simply can't. Right? Because if the reason for varicose vein is prior DVT, then you can't do surgery unless the deep veins are patent. Okay? So that's how you put it at the exam. Well, this patient has, can tell you. If you cannot demonstrate it, so I cannot demonstrate it, but I'd like to do this. Even if you can demonstrate, you say I'd like to get a scan done to exclude DVT. So that's how you put it. To conclude, you have to also check the pulses of the patient, which you can do either in the standing position or when the patient in the lying down position. So before you do the tourniquet test, just check the pulses. Why it is important? Yeah, you are putting tight layer bandages after surgery, even for varicose vein ulcers, everything. In a patient with occlusive arterial disease, you cannot apply compression bandage. So it's very prudent to check the pulses in a venous disease patient. Okay? Clear? So remember 5 witches. If you answer those 5 witches, your answer is given for the exam. That's exactly what you have to explain.
Do we have to do that from the next
Yeah, you can say, for convenience sake, I would like to examine the abdomen and look for abdominal pelvic masses. Yes. Tap test and cough thrill can be done if patient has a long yes, you can do it. But if you have bulges of vein here and there, you cannot do that. It's a very crude test. But to do it, even to do that crude test, you should need to have a long segment of vein, long vein to do that, because you need to keep one finger there and tap from below. Will you feel it normally? This way? Vein below. But if you keep the finger and tap from below, tap from above, you should not feel it. Right? To do this test, there should be a long segment of vein. If you have bulge here and bulge there, you can't do this. Right? To do the tap test and cough thrill. What is the test to detect post DVT? Whether it's a DVT causing varicose vein? Perthes test. Generally, they don't recommend to do it because it's painful. You ask the patient to walk tiptoe. So read about Perthes test. Tourniquet test. What is the other name? Trendelenburg test. Okay, so examine the patient standing position. You can't examine the patient in seated position because veins are filled up only when the patient is standing, not when the patient is seated. That's a deadly mistake. Okay. So standing position, then answer those 4 witches: side, level, system, complications. Get the patient into in a position, check the pulses, empty, tourniquet, down, check for complications, then give your statement. Okay, so read about SEEP classification. SEEP, CEAP, clinical, etiological, anatomical and pathological classification. CEAP. You don't need to remember by heart CEAP, but if you know what is there, you know what are the complications of varicose. You don't need to know what is SEEP 6, SEEP 5. At least if you can remember C's, not EAP, if you can remember C1 to C6, that's better. Because if patient is active also, you can straight away say this patient is C6. Right? Active also. This is healed as a C5. So read C classification and read treatment options available. So Dulanjani, you are going to talk about treatment options of varicose veins. 5 minutes. Right?
When you are applying the tourniquet and getting the patient standing position, you get the veins all filled up, and after relieving the tourniquet also you don't see any improvement.
Oh, yeah.
Then the perforator is below.
Yes.
Are you able to get back the patient and do it at another level as well?
No, you don't have to do it at multiple levels because management won't change. Ideally speaking, you should, මෙහෙම levels වල දාලා මේ level එකේ තමයි තියෙන්නේ නේද? It has a clinical impact. At the exam, we expect you to perform only one. Because even to do this, it takes long time. Long time. It's a long short case. Otherwise, it's utter waste of time. Yes. Sapro complete. Sapro favor. Reflux එක පෙන්නන්නේ. The reflux එක තියෙන back flow එකක් තියෙන තමයි මේ fill වෙන්නේ. To show the reflux only, we are doing the tap test and cough test. As I told you, you should have a long vein to do it. කරන්නේ reflux එක. Back flow එකක් තියෙන එක තමයි පෙන්නන්නේ. Incompetence ඉන්න තමයි back flow එකක් තියෙන්නේ. Subproximal incompetence එකෙන් තමයි back flow එකක් තියෙන්නේ. ඒකයි tourniquet උඩින්ම දාන්නේ. මෙතනින් මේ හරිය perforators නෑනේ. If you read about anatomy, there are designated perforators. There are names also for those things. එක නම් තියෙනවා, අමුතු නම්. ඒ මත තියාගන්න ඕනේ නැහැ. උඩටම දාන්නේ.
So don't they need to palpate incompetent perforators?
Avashyam. So he will tell about the types of incompetences and the management options tomorrow. අදරට වැඩ තියෙනවා. කරන්න.
There's an ulcer. It's ulcer. We have to comment about the ulcer, like thinking about.
Definitely yes.
Ulcer season.
Yes. Then it will be like, we won't expect two. It will be taken as two cases. Depends on the examiner. If the examiner is very lazy to walk to another case, he will do both at the same case and finish it off. It will be counted as two cases.
Otherwise, rough idea about the
Yeah. If you get it depends on the comment. Examine this ulcer they are mainly concentrating on the ulcer examination. Examine this patient lower limb, they are mainly concentrating about the varicose veins, but you have to comment about the ulcer. It doesn't take long time. No, you just tell this patient has ulcer in the medial malleolar region, the sloping edges, and base is granulating. Just jump onto varicose veins. The fact that it is sloping ulcer in the gate area, it is most likely venous ulcer. So that is the management plan. We'll discuss the management plan tomorrow. What are the options available? He will talk. I just have to listen.
So other than doing areas, can we put fingers or a circle junction?
That is called Trendelenburg test. Yeah, it's difficult. Actually you can do it. You compress about 2.5 centimeter below and lateral pubic, you apply a compression. Do the same thing. Same thing. If I did leda bahina ora atome hatame hatu not your.
If we do it, we don't have to repeat the
No. Either Trendelenburg or tourniquet. Either. You don't have to repeat it. The same principle. You're blocking it. Any questions? Now can you all examine a varicose vein hereafter? Huh? Any questions? Anyone? කී දෙනෙකුට මේවා තියෙනවා? වටිනවා. හොරකම් කරයි. අර සංකල්ප තියාගන්න. ඒක ඕක අදිනකොට එක එක පැටලලා එළියට එන්න පුළුවන් නේ. එක දවසක් ගෑන ළමයි දුන්න ඔක්කොම 50යි ඔක්කොම සබ්බ සකරමානම වැටුණා. 50 වැටෙන්නේ හොඳයි. දා වෙන මොනවා හරි වටුනේ ඒක. අප්ප දාගෙන පදිනකොට මොනවද ඒත් දන්නේ නැහැ. Thank you. Varicose veins can ප්‍රශ්න නැහැ. So read about treatment option. We discuss treatment option. ඇති. යන්නද? ගෙදර ඕන දිල්ලියක ඵලයක්. ඕනම දිල්ලියක ඵලයක්. හෙට වෙනකොට history නැත්නම් ඉතින් මොනවා කරන්නේ නැහැ.
Thank you, sir.